Australia over the last 48 hours. One of those was reported via some media last night. There's been a further death in South Australia, so 2 over the last 48 hours. Both of these people. In this presentation, unfortunately, we have some sad news to report. 2 deaths that have occurred in South Australia over the last 48 hours. One of those was reported via some media last night. There's been a further death in South Australia, so 2 over the last 48 hours. Both of these people had underlying health issues, one person in their 60s, one person in their 90s. Yesterday we had 3,707 positive cases reported in South Australia, so an uptick from the past 2 days, but it's pleasing to see that we're still in the 3,000 range. We're seeing some pretty big escalations right around the country, and in fact my calculations this morning show that we have the lowest positivity rate per capita in the nation so far reported today. Of course, Western Australia hasn't reported, and they'll be doing particularly well, and the Northern Territory also hasn't reported. But certainly of the other states, South Australia seems to, as I reported yesterday, not be escalating at the same range that some other states are at the moment. We have also had a slight uptick with regards to hospitalisations in South Australia. 144 people are now in hospital in our state, so that's up from 123 reported yesterday. Also a slight uptick in ICU with 16 people in ICU in South Australia. Still only one person who is on a ventilator. And also I should report to you that we have 4 people in the Women's and Children's Hospital. So again, we're not seeing that trajectory that we were very concerned about a week, 10 days ago. So that's absolutely fantastic. And in fact, no children have been in ICU in South Australia at all so far. Testing numbers yesterday were up. So we had 20,489 tests conducted in the 24 hours to midnight last night. So it's really pleasing to see that testing working so well in South Australia. I had a pretty good check this morning across the sites, and again there are some hours at Mount Gambier, but most of the other testing sites are now moving extraordinarily quickly. So if you have got any symptoms, or if you are a close contact, it is very simple to go and have that very accurate PCR test today in one of our fantastic testing facilities across South Australia. What I was also very pleased about yesterday is that we had our highest ever symptomatic testing level. So we are really moving away now from doing a lot of surveillance testing for people that are going into a hospital maybe or travelling interstate. It is now dedicated to those people who are symptomatic and those people who are close contacts. That's absolutely fantastic. We will be upgrading our IT over the next week to make it even simpler to book in. At the moment, you need to go in site by site. This was something that was raised at a press conference 4 or 5 days ago. We're looking to make that even simpler for people to go in, use the IT, find out when the next available spot is across South Australia, and then make your choice regarding booking in. We also have conducted some further genome sequencing or some genome testing of those people who are in hospital at the moment. That was conducted on Wednesday this week. It's now showing 92-93% of all of those people in our hospitals are Omicron. So this is really very much becoming the dominant variant here in South Australia, like it is around the country, like it is around the entire world. I've also got some news for you with regards to staff within SA Health who are COVID positive or are close contacts. We have 356 staff across SA Health now who are COVID positive, so that's an uptick, but we've actually had a reduction in those people that are close contacts to 547. So in total about 903 people. But as I said to you yesterday and the day before, a lot of these people are continuing to work, but they're working from home. In fact, we're encouraging all people right across the state to be working from home if this is at all possible. We are still extraordinarily concerned about Omicron and we want to slow the spread down. South Australia's done very well to reduce mobility over the last couple of weeks since the 26th of December when we put additional restrictions in. I note that many other states are now putting the same restrictions in place that we put in place on the 26th on Boxing Day. They're now putting those in place in their states. We see big increases in restrictions in Victoria put in yesterday, New South Wales and Queensland in today. We did this back on the 26th because we knew what was coming and we wanted to do everything we could to slow the spread, and it would seem that there is a slowing here in South Australia at the moment. The number one thing that every South Australian should be considering at the moment is about how they can get their vaccination. And this is really something which is extraordinarily important, whether it be their first dose, their second dose, or of course their booster. I must say that I was very pleased to see that there were another 1,325 people going and getting their first dose yesterday. This is the highest it's been for quite some weeks. And so I'm grateful for those people that are making that decision to protect themselves and their family, their workplace and their community. So a big uptick yesterday in people getting their first doses, another uptick yesterday in terms of those people getting their second doses. And in total, we had 19,432 vaccinations administered yesterday. So it's 3 days in a row where we've been up above 19,000. That's great, but we want more, and that's what we're here for today. Professor Spurrier and myself announcing that what we will be doing is setting up this Mile End fantastic home of netball as a pop-up vaccination clinic. It will open on the 12th of January. It will start with administering 5,000 doses per week, building up to 15,000 doses, and we want to make this a dedicated site for those wanting to get their boosters. So there are a lot of people who are now eligible for boosters in South Australia, courtesy of shortening that time frame between the second dose and the booster. Originally it was 6 months. We've now had advice from ATAGI and the TGA to reduce that down to 4 months. So this makes hundreds of thousands of South Australians now eligible by the end of this month, and that's why we're flexing up our capacity in terms of boosters. 5,000 here starting on the 12th of January, flexing that up to 15,000 per week. And the good news is you can go online and book in to get your booster here at Mile End as of today. And we will still be looking at all and every single opportunity for people in this state to get their vaccinations. There are thousands of additional appointments opening up all of the time. If you don't get the exact date that you want, please go and refresh. Often there is more capacity being added as we get more and more people coming forward to help us with this incredibly important vaccination program. So the good news, more booster vaccine appointments available from the 12th of January here at Mile End at the Thunderbirds home. I know that this is going to be a big relief to many people, and there's plenty more coming that we'll be announcing in the coming days. So I'm happy to answer any questions at the moment, and then of course Professor Spurrier can give some further details if required.
You mentioned yesterday that there was going to be an announcement today about additional capacity for vaccinating children given the start of the school year. Is this it?
So today's announcement is really about boosters, but of course this creates capacity right across the system in South Australia, and there will be other announcements with regards to how we can flex up the availability of boosters for children. But this is, vaccines for children 5 to 11, which become available on the 10th. Of course, putting these additional 5 to 15,000 doses into the system will relieve pressure on other sites across the state. We're not just doing this by ourselves, of course, in South Australia. We've got to be very grateful and acknowledging the great work of pharmacies across South Australia and GP clinics across South Australia who are massively flexing up their capacity. In South Australia, it's about a 50-50 joint venture between state clinics and also the primary healthcare sector, GPs, pharmacies and of course the Commonwealth in the aged care facilities. And so this is, I think, probably one of the highest in the nation from a state perspective, and we're looking for those opportunities every single day.
Some GP clinics say they're struggling to get their hands on enough doses to vaccinate children. We hear that 200 appointments were cancelled overnight for appointments at McGill. Is it hard is there a supply issue? Have we not had the doses we were meant to get flow through, because this clinic says it ordered 300 and only 100 arrived?
So the allocation of the paediatric doses is a requirement of the Commonwealth. So they basically source the vaccination doses for the 5 to 11-year-olds, just as they have done for the adult population. They are collated centrally and then distributed to the state. I'm quite sure at the moment that demand does outstrip supply, but we're certainly getting our pro rata entitlement in South Australia. They're being allocated, and every opportunity, as more doses come into Australia, then we'll see those opportunities flex up even further.
What's your message to those parents, I guess, who've had these appointments cancelled? They're worried for their kids to go to school.
It's hard to understand what's happened there, whether or not there's actually the GP clinic has, thought they were going to get more. I'm happy to take that question on notice and come back to you and issue a statement later today.
That lots of parents who want their kids vaccinated at the moment can't get them vaccinated.
So what we're doing is working through every single opportunity to get children doses as quickly as possible, 5 to 11-year-olds. We've opened up thousands of appointments, and there of course will be more coming in the coming days as we get more of those vaccination doses into South Australia. But ultimately the dose distribution is one from the Commonwealth. They told us at our last National Cabinet meeting that those paediatric doses, which are different from the adult doses, are coming in. They're going to be in plentiful supply, so I'm happy to chase up any of those specific logistical issues that might arise with a specific GP clinic.
Sorry, can I just ask you on schools?
Yes.
Queensland Premier Anastasia Palaszczuk has made a public announcement today, and she says, and I quote, "I want to assure Queensland parents there'll be no return to primary school at the peak of the Omicron wave. We are looking at the option of delaying the return to school." Is there any considerations for our state schools to delay opening?
Yeah, well, I think I've said, pretty consistently for the last 7 to 10 days that we're looking at all and every option with regards to students. We want to make sure that they do return to school, but they do it in a safe way, both for the students and for the teachers. It is our absolute preference to get students back to school because we know they have much better learning outcomes being in that face-to-face environment. We saw that over the last 2 years. We were the first to get our students back to school 2 years ago when many other states were delaying the return of their students. We did that very safely in South Australia, but we need to consider this return to school in light of the Omicron variant and in terms of vaccination status. So we had a meeting, our COVID Ready Committee meeting this morning, focused on this issue. There's still more data to collect, there's still more information to collect, and that's precisely what we're doing at the moment. I'm happy to make a commitment that we'll reach our conclusion by the end of next week, but we still do need to get further information. And there is a National Cabinet meeting which is scheduled for next Thursday. As I said, I would hope that we could make our decision. Well, in fact, we will make our decision in South Australia by the end of next week, but there are still lots of moving parts.
You said that you were looking at further announcements about vaccinations for that 5 to 11 age bracket. When can parents expect that, given we are looking at a return to school in a few weeks' time, and there are a lot of parents, as Andrew mentioned, who are really quite anxious? Are you able to ensure that all those children who want to get vaccinated, or all those parents who want to vaccinate their children, will be able to before the start of term 1?
Well, that's going to depend on the availability of the vaccine, but I don't envisage there'll be a problem there. But we will be opening up more. More opportunities for people to get vaccinated. We've demonstrated that. I think our vaccination program at the moment is amongst the highest in the nation from a state perspective. Very proud of that. It was lagging a little bit around New Year's. I don't know what people were doing, maybe just sleeping in, not going and having that vaccination, but the last 3 days have been up over 19,000. That's a really good run rate, so we're very pleased with that, but we would like to see it push up even further in South Australia.
Will that include mobile vaccination clinics in schools? We know that there was some success with that particular program late last year. Is that a program that you're looking to expand? The Education Minister flagged up for prospect earlier in the week. It's
worthy of consideration. It's one of the things that we discussed today at our COVID Ready Committee meeting. It had limited success. It was particularly useful in those schools which had a lower underlying vaccination rate, but it does also have the complexity associated with it that you need to get permission from parents to administer those vaccinations. So we take all of those. We'll take all of those things into consideration, but ultimately we want to get as many jabs into the arms of South Australians as possible. I'm really pleased with the way that it's going in South Australia, especially over the last 3 days, and I can't see any reason now that we're opening up more and more appointments that we're not going to continue to see a surge in terms of the vaccinations delivered in South Australia every single day.
And Privy, just to clarify, exactly when do vaccinations open for that 5 to 11 age group in South Australia? Is it on Monday or is it on Wednesday?
Well, they've been online now for several weeks, but it's on the 10th is the first day that we are allowed to administer it, so the 10th.
Because there's been some obviously communication from SA Health suggesting it's on the 12th, so it's definitely the 10th?
Yes.
Have you asked the federal government for more, or is there simply no more?
No, we had a presentation from Lieutenant General John Fruin, who is in charge of the vaccination distribution at the last 2 National Cabinet meetings. He was very confident that we would have all and every vaccination dose that we need coming into Australia over the next 4 weeks. We've already got all of our we've already had our first doses come into Australia. And we're ready to go as of next week here in South Australia. The issue now is trying to get as many jabs into arms as possible, and that means standing up more and more capacity across our state. As I said, we are delighted with the vaccination level in South Australia, especially over the last 4 days, but we'd like to see it go even higher. We'd like to break that 20,000 barrier per day on a very regular basis, and that means that we'll get South Australians even more protected than they are at the moment. We know that the booster is a great protection against getting the Omicron variant. It takes you back to where we were with the Delta variant with 2 vaccinations, so that's absolutely fantastic. But most importantly, what the booster does is it really reduces the likelihood that you're going to end up with severe symptoms, ending up in hospital or maybe on a ventilator. That's something that we want to avoid, and that's why we're working so hard to get those vaccination jabs and those boosters into the arms of South Australians.
Barry, how do you find the staff to set up another clinic such as this? As you mentioned earlier, you've got more than 300 SA Health staff currently off at the moment. So where are the staff going to come from to run this particular site, and will it have any impact on other vaccination clinics? Are all our other vaccination clinics staying open?
Yes. So 2 things. First of all, we're working with the private hospitals in South Australia. So you would recall that recently we put a pause on non-urgent elective surgery Category 2, and basically we can have Category 1 and urgent Category 2 only going forward. So we've been working with private hospitals to utilise their staff to man these vaccination facilities, and there'll be others that we'll be able to reach agreement with in the coming days that we'll also be able to talk about. And the second thing is, you'll notice now on the SA Health website that we have got a call out to people, recruiting people who have got the skills, maybe retired nurses, retired doctors. We've had a lot of people saying, how can I help? We've now got a landing page on the SA Health website which just provides people with the opportunity, and we have been amazed at how many people have said, I really want to help out. I know that this is going to be a mighty battle to get as many people vaccinated as possible. I'm qualified. How can I help? Well, now they can go to the SA Health website, they can register, we'll get in touch with them as quickly as possible.
On the testing issue, once the RAT tests are available to close contacts, with the QR code, will it be a legal requirement for them to use the QR code to log their result, or will it just be strongly encouraged?
No, I don't know about the legal. I'd have to see whether we're going to change the direction there, but we really do want to capture all of that information. So I'll come back to you whether the Police Commissioner is thinking of changing that direction. But look, people have been compliant in South Australia since day one, and of course if they've taken it, we actually have their contact details. That's part of handing them the RAT kit in the first place. So at the moment the Police Commissioner is working on creating dozens and dozens of sites across South Australia where these RAT kits will be able to be collected. They will be both in metropolitan Adelaide and a large number in regional South Australia.
In regards to aged care, how many homes are currently in lockdown? How many cases are in lockdown, and cases are there, in aged care? And is there any view to making it mandatory for aged care workers to have a RAT before they go to work?
So obviously aged care is the responsibility of the federal government. I don't have those exact numbers, but I'm quite sure we could get them for you later today. We do have a large number of residential aged care facilities across South Australia who either have a resident who is positive or somebody who, in their workforce who is positive. And this is of course a very vulnerable community. We're really pleased to be working with the residential aged care facility sector here in South Australia. They've been hugely cooperative in terms of supporting their staff and of course their residents during this pretty difficult period. In terms of the rapid antigen test prior to start, again, it's a federal government responsibility, but I'm very happy to ask them what their plans are with regards to that. In South Australia, we have procured a huge number of rat kits for South Australia. In excess of 10 million kits are on their way or have already arrived in South Australia, and these will be utilised where we need them to be utilised, and it's quite possible that we will be requiring some residential aged care facilities to use them from a state government perspective, but it's also possible that the federal government would be requiring a surveillance type testing for those people who are going to work or contractors that are going to go into those residential aged care facilities.
Speaking of rat testing, I understand rat testing is being used across South Australia's food distribution network with major supermarkets and retailers, and that is having obviously catching a lot of people who are COVID positive. Do you have any reservations about the state's food security at this point in time, considering the impact that is having on supply chains?
So we've seen around the country food shortages on shelves, not the production of food, but just the distribution of food as more people and workforces are affected by COVID. We're mindful of that here in South Australia. To date, I haven't been alerted to any significant problems in South Australia, but I think we've got to just realise that we're in the middle of a very significant outbreak of Omicron right across the country at the moment, and this is going to affect supply chains. It's one of the reasons why at the last National Cabinet meeting we made a decision with regards to the testing of the truck drivers. So again, we were making sure that we weren't holding them up, delaying them unnecessarily, because we've got to keep Australia moving and we've got to keep food on the table during this particularly tough time. So we'll continue to look at it in South Australia. It's one of the reasons why we have got slightly higher level restrictions in South Australia compared to other states. We've got a different definition of close contacts, and we've got a different requirement in terms of isolation if you're COVID positive, and we're doing that to preserve workforce, quite frankly. Yes, it does put more people into isolation, but it stops the disease getting away from us. As I said earlier, I think South Australia today has the lowest per capita positive rate of any state except for Western Australia. We've still got a mighty battle on our hands, and we've got to continue to observe the social distancing requirements. We've got to work from home where we can. We've got to use the QR code check-in, and most importantly, if we develop any symptoms whatsoever, to go and get ourselves tested. And the good news is those lines are shorter and shorter. There are very short delays now for people that are going to one of our testing clinics. And again, I would like to thank all of our pathology staff in South Australia, whether they be at SA Pathology or one of the private labs. They've done a great job in terms of that, dealing with that massive surge that we've had, not only here in South Australia but around the country. I think South Australia's been particularly well served.
Are you concerned about an explosion in cases in Robe, and have those cases may lead to any particular event?
So not particularly in Robe, but there has been an outbreak in Narracourt, which is not that far away from Robe, and so we're just mindful of that at the moment. So we're just putting a rapid assessment team into actually having a look at that. We're also concerned about 2 positive cases that were reported in Umata, which is just south of the Northern Territory border on the Ananu, Pitjantjatjara, Yunkinjatjara lands. We've now been able to evacuate those 2 positive people and their close contacts into more appropriate accommodation in Adelaide. We've set up a rapid response team to Umata, where we are looking to test all of the local Anangu and staff working on the lands, working in conjunction with Nunapa Health. To date, I haven't had any positive results reported to me, but we're keeping a very close eye on that.
In regards to the southeast, is there any plan to introduce restrictions on interstate travellers into areas like Robe and Narracourt?
No, not at this stage, no.
Can you provide some more details about what the outbreak is linked to in Narracourt, Premier?
No, I just got some basic information this morning that there was an outbreak in Narracourt, so I'm happy to follow that up and come back to you.
Do you know how many cases in Narracourt?
No.
Just briefly, Premier, what's your own personal testing regime at the moment? Are you having a rapid antigen test daily?
No, not daily, but we do have a surveillance routine in place for the people that are dealing with the leadership, if you like, of the pandemic, and that's been put in place by SA Health. So I've had my initial training, and I think I've had 2 subsequent surveillance tests.
And those tests are coming?
They're both negative, yes.
We just moved to Professor
Yes.
through, if you don't mind.
Thank you, and it's lovely to be here today, and absolutely terrific to be part of the opening of the Mile End Vaccination Clinic. And I know that you've got some questions for me, but I did want to just put a little bit of perspective around how we're tracking and travelling here in South Australia. So you can see, South Australians, that the numbers are really increasing interstate. We are hoping that we're going to keep the curve suppressed, and the reason that we're trying to do that, and I'll explain how we've managed to do that, and it's really partly through all of the hard work that you've all put in as community members here. But what we're trying to do is give time to get the third dose into everybody, and allow everybody that is eligible to have that third vaccination dose, that they can come and get it. And so it's fantastic having Mile End as an additional site. And as the Premier said, we are looking at additional sites. We really want to ramp up our vaccinations in our state. Some of the other states, they had taken down all the infrastructure for the vaccination, their large mass vaccination clinics. So we are very fortunate that we still had many of those standing, and as you can see, we're putting an enormous effort into getting further sites up, because it's the most efficient way of vaccinating a large number of people. So looking at our numbers today, 3,707, it hasn't skyrocketed, it's not escalating, and the reason for that is we put those public health and social measures in place. There's three things you can do in a pandemic. You can use those public health restrictions, you can vaccinate, and then you can do your testing and contact tracing. And so making the change in the density in our hospitality, having a very strong message to work from home, and also requiring the mask has meant that we've been able to get on top of that curve. Now, in terms of the contact tracing, again, very pleasing that we've seen the decrease in the lines for people getting tested. Not to say that we've dropped our testing numbers. The testing numbers are fantastically high, and if you have symptoms, it is so important that you get tested. And as people know, because the Premier's already flagged this earlier this week, we will be distributing rapid antigen testing for, particularly in the first instance, close contacts. So that's really where we're at in terms of the strategy, and we've still got a lot of work to do. You haven't seen me behind the camera much recently, but just to reassure you, I've been working very hard, trying to keep those case numbers down, trying to keep the contact tracing going, obviously tweaking all of the testing, and then of course providing leadership around the vaccination. So very happy to take further questions. I do know a little bit more about Narracourt and Robe as well, if you would like some further details.
That would be terrific, Professor. Could we get those, please?
Yeah, so at Narracourt we do have a large outbreak in one of the abattoirs there, and we do have over 100 people who we know are sick, and the company has been doing rapid antigen testing there. So our team stepped in yesterday to increase the amount of testing, and also to bring in an outbreak management response. So that's where we're at the moment. Of course, we want to make sure that is just localised to that abattoir, and that we don't have spread further in the community. Now, as for Robe, it sounds from the intel I've got that Robe is a fabulous place to spend New Year's Eve, and indeed it was a very popular destination over the New Year's Eve period, and a large number of tourists did flock there, and we have seen a large number of cases coming from that area. So many people have holidayed there and have gone back to their own part of South Australia. So if you did spend any time in Robe over the New Year's Eve period, I want you to closely monitor for symptoms and go and get tested. It's now obviously quite some days from that New Year's Eve celebration, but it's still very important that you go and get tested and let any of your close family members know that you're symptomatic. So we're still expecting to see a number of cases from that particular area.
Well, how many,
Professor, can you look down a little here?
Sure.
how many cases do we have in Robe at the moment by your calculations, Professor?
I don't have the exact number. We can try and collate that and give it to you later. But we've put one site up on our website, which is the New Caledonian Inn. So we know that there was an event over that period of time, and the times and the dates are there. I know it's now getting on for 7 days, but particularly, you don't have to have developed symptoms straight away. So if you were part of that event, I do urge you to go and get tested if you haven't already done so.
Professor, what's
Primarily
your...
amongst the younger demographic at Robe, like young people partying out there over the years?
Yes, so as I'm not part of that generation, my intel comes from my children, and they did say to me that it was a very popular destination over that period of time. So I do suspect it is going to be that younger cohort.
Professor, what's your latest advice to the government around the return to school later this month? Do you have reservations of going back to in-class learning at this point in time?
So it is a tricky question, but I've always said before, as a paediatrician, school is so important for children, and the one thing I would always like to keep open is schools, because it's not just an educational facility, but it's also a safe place for many children, and it supports their psychological as well as educational development. So when we're in the middle of an outbreak, we need to make sure that we can run the school, and of course if we do have, depending on what our numbers are looking like in the state, it's likely that there'll be teachers who are ill, and it may be that there's also children that are ill. So I think we could say quite clearly there's going to be disruption, and it's not going to be such a straightforward start to the school year, but I certainly would like to have it opening as face-to-face as soon as possible, and hopefully in line with the normal start of the school year. As the Premier said, we are looking at some further information. We're plotting what our numbers look like, what we think our curve is going to look like, and then trying to factor in with schools opening what impact that would have. There are other ways, I guess, of making our community as safe as possible and reducing the number of cases, and actually one of those is through vaccination. So if we're looking forward to having children return as safely as possible, the more people who are in the adult age group that have got their third dose, in a way you're protecting the children as well at that critical point of going back to school.
Would you rather them be homeschooled at least in the first couple of weeks, so there's time for the vaccine to kick in?
Look, I think it's very useful to have alternative models for different children at different times. I think there will be quite a number of children who may be too sick to go to school, so it's advantageous that there is some online learning. But the best type of education is face-to-face, and we've been working very closely with education to try and make the schools as safe as we possibly can. I think it would be, I think really to be completely pragmatic, we are going to have some disruption with schools starting, because we will have teachers sick and other support staff in schools sick at that time, and as I said, some children will be ill as well, but I think all of us are going to try and work towards having face-to-face at the normal opening time.
Professor, you talk about trying to get a feel for where the numbers are going to be when schools reopen. What is your latest modelling showing you about what the next 4 weeks in South Australia looks like when it comes to positive cases? Are we going to be looking at a doubling again? Are we looking at 5,000, 6,000 cases a day, or are we close to a peak now?
So we're definitely not at our peak now, and I think the Premier's already flagged that we're expecting a peak towards the end of January. We're trying to keep those cases as low as possible. Now, when we talk about cases, sometimes we are not picking up cases in the community. So we have our positive cases that we pick up on PCR, and we'll be moving to include a rapid antigen test as absolutely also included in a positive case definition. And I want to do that as rapidly as possible, because it's important that people who've had a rapid antigen test and that it's positive, we're also flagging in our system. But there will be a group of people as the numbers go up that we don't actually pick up. So I'm quite keen to be able to talk more publicly about the modelling we've done. At the moment, because we've only been into this in a certain number of days, we do need a bit more data for more stability there, and that'll be up to government to make a determination about how that's released.
Professor, you mentioned that you haven't been present at press conferences over the past few weeks. Does that have anything to do with any tension between yourself and the Premier? And has there been at any stage over the past 2 weeks, during your discussions with the Premier, have you threatened to resign or discussed your resignation? Oh, no, absolutely not. I did hear these rumours. I also heard from my kids that someone thought I had COVID. So no, I haven't had COVID. I get on extremely well with the Premier. Had dinner at his house a couple of weeks ago. We spent a lot of time talking. We need to be on the same wavelength, along with the Police Commissioner, also the CE of Health and the Health Minister. We've worked extremely well here in South Australia as a team, and I think that's why
why we are in a really good place here at the moment. It might not seem it when you see the numbers, but certainly in comparison to some of the other states, I'm very happy with how we're managing to deal with the Omicron outbreak. Of course, it's not just because of what we're doing, it's also because South Australians are fantastic at hearing the messages, getting tested, getting into isolation and quarantine and the like, and also, of course, getting their vaccinations done.
Professor, how disappointed were you by the decision to change the definition of a close contact at a national level and the impact that may have had in South Australia and our state's ability to manage the COVID outbreak?
Look, I think all of the states are at a different stage, and we felt that our capacity was such that in terms of our contact tracing that we needed to have a more narrow and I guess more biological based definition of a close contact, and so we're going to continue using that. It is important to try and stop those chains of transmission, and we really felt that was important from our perspective. So yeah, I really have nothing more to say on that. It's just where we happen to be, and I'm glad to say that making that decision, but also bringing in the restrictions earlier in terms of masks and hospitality and such like, it looks like we have started to see that curve come down compared to the other states. It's a really tricky, it's very tricky to make these decisions. It's always in the rear view mirror because the behaviours that we have today determine what the case numbers will be in 2 weeks' time. And so you're always having to try and predict and make decisions based on something that you don't know. And especially with Omicron, we're only learning more and more about it all the time. It's like a, basically unknown at the beginning. So I think in retrospect we can say we've made good decisions here in South Australia, and I would say absolutely it's because we have excellent relationships between the leadership team, particularly here with our Premier.
Just to follow up, just to quickly follow up Ella's question. Just so we're really clear here, Professor Story, at no point in the last fortnight have you threatened to resign from your post, even after a phone hookup for a teleconference which took place on December the 30th, which involved the department CE and other senior members of SA Health staff.
Now, why would I threaten to resign from this sort of job? I'm here to deal with a pandemic, not to sort of mess around. I'm here to do a good job. I'm here to lead a pandemic response, and I will say absolutely no to that sort of question.
Do you think, though, that for South Australians, having their Chief Public Health Officer come out and address them over the past couple of weeks when things have escalated here would have been appreciated?
Oh, look, I'm always available to come and do a press conference as part of my job as a public health physician to talk to the public, and I look forward to any opportunity I'm given. So I'm asked by government to come and make to join the Premier. What we have been doing is providing a very detailed briefing every day for an hour before the Premier does his press conference. I think you'll agree that he has been very well briefed. He's been able to answer all of your questions, but it is very nice to be back here again to talk to the public.
So you were effectively sidelined by the Premier's department?
No, I'm doing my job. I'm working very hard. There's been lots to do with this number of cases. Helping with the vaccination, supporting my team. We're getting more staff in, making sure that they're trained. I can tell you all that I have been very, very busy. My family will vouch for that as well. We can't always be here together in front of the camera. The Premier has done an excellent job. You will see the Health Minister from time to time. You'll also see the Police Commissioner from time to time. But we do, we can't all be here all at the same time.
Was it a bit of a slap in the face to not be asked over the past week?
No, not at all. I have got I've got lots of other things to do, but I do enjoy coming and talking to the public, and I don't have a problem answering your questions at all, but it is actually a pleasure to talk to South Australians.
Professor, can I just ask you, if I may, are you concerned about the underreporting of cases here in South Australia? And are you confident that the numbers that are being reported daily are an accurate reflection on community transmission here in South Australia?
It's a really good question. So at the moment, because we have good PCR testing, and that's thanks to SA Pathology and of course our private providers, we feel we've got reasonable ascertainment. But as the percentage of the test becoming positive increases, we know that it will there'll be under ascertainment, and that's exactly why we are wanting to bring the rapid antigen test on in a more systematic way to allow close contacts to use that as an alternative.
So therefore, also not only for the testing and the people actually getting tested. Are you concerned that there is a underreporting because of people being asymptomatic and not believing that they've got any symptoms, therefore to get tested and therefore going around in the community without knowing they've got COVID?
Look, I don't think that's really at the top of my list of concerns. I think South Australians understand if they've got symptoms, they need to go and get tested. It's our job to make sure testing's available. We're rapidly moving to have the rapid antigen testing being brought on board as well, which I think will assist people. And that's planning ahead because I suspect our case numbers are going to get higher.
And therefore, as a result of those cases and what you yourself and the Premier saying with the wave, we're not at our peak yet. Do you anticipate or do you believe that there are further restrictions that are going to be needed to keep that peak under control?
Look, I've been very pleased with how our current restrictions are appearing to work. I think you have to see that hand in hand with the testing and the contact tracing, and also hand in hand with the increasing number of people getting vaccinated, including that very important third dose. So we'll be watching it very closely. The interesting thing about Omicron is when you look at the virus, it's obviously very transmissible and can infect people very easily. But a lot of it is about what we call immune escape, so that your immunity because you've had a COVID infection before, or your immunity because you've been vaccinated before, doesn't hold this particular variant as well as it held Delta. But on the other hand, the scientific thinking is that the intrinsic transmissibility of this virus is a little bit less than Delta, which from a theoretical point of view means that you don't need such hard public health and social measures in terms of those restrictions. So, of course, much of this is theoretical, but it looks like at the moment what we've done in South Australia, and again, it's because people have followed those rules. People are working from home. Businesses have cut down the numbers. They're using COVID-safe plans and the like. And because of all of that, I think that's why we're seeing the numbers as they are at the moment. Now, things can change, but we won't be going just on the case numbers. We'll be looking at hospitalisations as well. And also it's important that we are referring this back to some modelling because otherwise you can overreact, I guess, if you start to see case numbers go up. But the trajectory at the moment, I'm pretty pleased with.
Professor, can I just get you with the mind back to the vaccination program, and particularly this idea? We know that the Premier's just mentioned that you're recruiting, potentially retired doctors, nurses. You're going to be leaning on the private sector as well. Just how big a challenge is it going to be over the coming 4, 6, 8 weeks to get enough people qualified to put needles into arms? And are you also looking to lean on final year medicine students, pharmacy students, nursing students as well to help boost your staffing up?
So we've definitely lent on a lot of students, and our final year medical students have been fantastic as contact tracers, and unfortunately they've moved on and now they're interns and working in a hospital system, so that was a bit sad for us and our contact tracing team to say au revoir to them. But in terms of calling out to the whole state, this is a whole state effort, and we are very hopeful that there are people that may be working part-time and have some capacity who are able to give vaccinations, and that's the sort of group that we're calling on. Certainly people who have recently retired may be very interested in coming back and helping us with this effort, because this is the way we're going to deal with this Omicron outbreak, is getting the third dose into as many people's arms as possible.
Are you aware of an outbreak at the Woolworths distribution centre at Jets Hospital?
No, I haven't heard about that one, I'm sorry, but we have got quite a number of outbreaks across the state, and you asked earlier about the number of nursing homes, and we can give you the exact figures, but we've got over 100 nursing homes who by definition have an outbreak.
What's the definition of an outbreak?
So for in an aged care facility, it's if you have one resident or 2 staff member infected. So it's quite a tight definition, but that's because it's a very vulnerable setting.
Professor, I know we've spoken a bit about schools already today, but what about childcare centres? What's your latest advice to the government around childcare centres? We know that there are dozens already around the state that are closed because of COVID-related issues. Are you concerned that's obviously going to have an impact on people's abilities to work if they're going to have to stay home with their children? So
yes,
what are you telling them?
Look, absolutely, but there are certain things that you can't control, and I think if you look at it as the whole strategy of trying to keep the curve down as low as possible whilst we get everybody vaccinated, that in essence improves things for aged care, for childcare centres, for schools. In terms of an individual childcare centre, obviously if their staff are all sick, they're not going to be able to operate. So the more we can do as a community to try and stay home if we're sick, to get tested, to stay in isolation if we happen to be a case, to follow the quarantine requirements, to get vaccinated, all of those things are important in terms of keeping those numbers down and allowing our society to continue as much as it possibly can through this really, really difficult time.
Last few questions, guys, because we've just on vaccinations. Sorry, just on vaccinations. Sorry to skip around topics, but for that 5 to 11 age bracket in particular, we're hearing that January's all booked out, a lot of February's booked out as well. Is the issue supply, or is it actually staff members to administer the doses? And are you concerned that that vulnerable age bracket heading into school are not going to be able to be vaccinated?
I think South Australia will be doing absolutely the best it can to get as many children vaccinated in a short period of time. So as we flagged, Mile End is the start. We're opening this for boosters or for third doses, but we have got plans that we're working on, and that's one of the reasons I haven't been in front of the cameras, but we're working on these plans to get other centres up and running. So we really are going to focus on opening up further bookings for that age group.
Is it supply or is it actual staff numbers, though? That's the issue about why those extra appointments can't be opened up immediately?
Yeah, so it'll be a combination. We're definitely needing to get staff on, and that's why we've now got a landing page and we're calling on people to come and help us with the vaccination effort. And as we get further sites, such as this one, up and running, we'll be able to open up more of those bookings. And that won't just be for boosters, but it will be for children as well. So keep watching the website and we will have further bookings coming on board.
In regards to Adelaide International, were there any tennis players allowed into South Australia who weren't vaccinated with a medical exception?
No.
Professor, can I just ask you, can you please explain the difference with allowing some COVID-infected workers in the disability sector to be able to go back to work, but at the same time you are saying that close contacts of families of COVID patients have to quarantine for 14 days. Could you please explain the difference with that, please?
So there's just been a very small number of instances where we've had a person with a disability who's a case cared for by somebody who also has COVID. And if you think about the disability space, there's often a carer that has a close relationship with that particular individual. So it's only been in the instance when the carer is actually positive but is well enough to work, and they've said, I'm okay to work, and the person with the disability also is positive. So there's no risk then, because obviously they're both positive.
So therefore, is there, what do you say to people that believe that's confusing messages, that at one instance you're allowing infected people to interact with each other, but then at the same time placing people in quarantine for 14 days if they're a close contact, family close contact of someone with COVID?
Well, I think in general we're providing information to the public, but we obviously come across niche issues like this, and really that carer in that disability setting is almost a household contact of that person. They were both positive, so it wasn't putting anybody at risk, but from a practical point of view it meant that that person with the disabilities received the care that they needed.
Do you think that the quarantine rules are simple enough for the general public to understand, Professor?
Yeah, so one of the things that perhaps has confused people is we are allowing people, if you cannot separate as a family, and it's really because we appreciate that when you've got somebody in your family tests positive, it's not always possible to separate, and the reason might be because they're children and they need to be cared for, or it might be that you don't have any other arrangements and your house is of a size that you can't separate easily. So to be the purest approach would be is that the first person stays in isolation and the family's with them, and then once you've got to the end of the 10 days, then 7 days starts for quarantine for all of those family members. Then somebody else might test positive along the way, and then the quarantine period starts all over again. And I don't know if anybody remembers, but we actually had a family in our quarantine hotel, in our Medi hotel, the year before last, and they were in there for 45 days as subsequent people in the family became positive. Now, I don't think anybody would want that in South Australia. So what I said was, let's be pragmatic about it. Let's say that you're a case and you've got your 10 days of isolation. We're going to assume, because Omicron is so infectious, that everybody's going to get infected in the first 4 days, and then we add on the subsequent 10 days, so that in total it's 14. So you're in there at the beginning, your case finishes their isolation at day 10, and then everybody else does 14, to make up for the fact that we do not want an unfolding and a snowballing effect, and we just needed to be pragmatic. So it was really a simple way of achieving what we needed to achieve.
And can I just ask, Professor, some details on the people that are in hospital and the people that have sadly passed away? Do you have details on their age and gender, etc.?
So as the Premier said, we unfortunately, and it's very tragic, we've had a person in their 90s and a person in their 60s pass away, and that would be counted towards one of our deaths in South Australia from COVID. I haven't got all of the other details of our hospitalised patients, but we will try and get those details to you so that you've got a bit of a picture. What I can say is, looking at the vaccination rates for people in ICU, about 80% of people in ICU are not fully vaccinated. So it really is so important for everybody to get themselves protected. It is life-saving. It's readily available. Of course, we're here pushing the 3rd dose, but I know there's still people out there that haven't even had their 1st dose. Omicron is here in our community. Many people are getting infected. It's really important that everybody protects themselves.
Right, thanks everybody.
Thank you.
Thank you.
It looks great.